Welcome all to the Brain Health and Wellness Initiative series. Tonight, our speaker is Dr. Dennis Grossman, and he's presenting on functional medicine and dementia, understanding and applying functional integrative medicine's approach to dementia. My name is Hannah Doles, and along with my colleague, Nicole Herbert-Hale, we provide care navigation in the JFSA Dementia Care Navigation Program. Our program establishes an empowering environment to help improve the quality of life of those who have dementia or at risk of developing dementia, while helping family caregivers reduce the stress and burden that often occurs while caregiving. At JFSA, we understand the importance in working with our clients' strengths and applying a person-centered approach to care, which extends throughout our multidisciplinary team of geriatricians, nurses, social workers, and geriatric psychiatrists. Nicole and I meet our clients where they are at and develop individualized care plans that help produce solutions to presenting problems. From linking persons with dementia and their family to community resources, to following them with their medical management. We are their point of contact for guidance as well as a listening ear. We consider the intersectionality of one's life when creating interventions that adhere to their biopsychosocial needs and experiences. So again, you will be able to ask questions at the end of our webinar today. So please feel free to use the Q&A button when submitting a question. We are also offering CE credits, so it will take 30 days from the date of your application, which is the completion of the survey, which you'll get within a week of our presentation, and it will be emailed to you. And just note that the email address that you use to access the webinar must be the same one as you are providing. If there's any issues with that or questions, please feel free to reach out to Nicole and I to ask about that so we can make sure you get your credit. So a bit about our presenter tonight. Dr. Grossman is a graduate of Case Western Reserve University School of Medicine with over 30 years experience in internal medicine. He has been on the staff of University Hospitals Bedford and Ahuja Medical Centers, Cleveland Clinic, South Point, and Marymount Hospitals, and Metro Health Medical Center, where he was the former medical director at JFSA and a clinical instructor at the Case Western Reserve University School of Medicine. For the past 30 years, Dr. Grossman has been interested in the effects of diet on chronic Western diseases and promoted plant-based diets and macrobiotic diets. Dr. Grossman believes that they play a key component in preventing and reversing some types of diabetes, hypertension, heart disease, stroke, and degenerative joint diseases. Thank you, Dr. Grossman, for joining us tonight.
Thank you, Hannah. And it is a pleasure to be back. I chose this topic. I've educated myself a little bit, and my goal here is to kind of give you some terms, some understanding, and then some ideas to how functional medicine works in terms of treating or preventing diseases of the nervous system, specifically dementia in this case. So I listed, and again, this is not complete, and a lot of what I'm going to give you are sections of the problem, but this is a list of some of the terms that are alternative types of medical care. So if you look at this, the first one is holistic, second one is alternative, third is homeopathic, fourth is naturopathic, the fifth is functional, the sixth is integrative, and the seventh is complementary. I'm going to try and break that down and make it a little more digestible. So holistic medicine. Holistic medicine is is something that is added on to conventional medicine. The consideration of the complete person in the management and the prevention of disease is their goal. It's really an attitudinal approach to healthcare. And in hearing Hannah's introduction as to what she and Nicole do, I think a lot of their approach is holistic. So this is just something that is added on to conventional medical care. It addresses psychological, familial, societal, ethical, spiritual, and biological dimensions of health and wellness. And they say the three keys are clinical, spiritual, and social. And it's a holistic term has been around since the 1920s. Alternative medicine. And this, I'm not going to go into the specifics right now, but I will get back to some of these terms that I'm going to throw at you. Alternative is any range of medical therapies that are not regarded as orthodox by the medical profession. And if you look at these, there's a whole slew of them: acupuncture, Ayurveda, herbal medicine, body manipulation, Reiki, meditation. So these are just, again, a whole group of non-traditional types of therapies that the mainstream medicine does not promote. Homeopathic. So homeopathic really started in the late 1700s by a man named Samuel Haberman. And his idea was that you could treat disease by minute dosing of natural substances that in a healthy person would actually produce the symptoms of the disease. So that's the theory behind it. It's obviously an alternative an alternative type of medicine based on the term like curing like. It's the law of minimum dose, meaning that the lower the dose, the more effective it is. So there are dilutions in homeopathic medicine that are infinitesimal. Well, I can't get that word right, but anyway, very small. Then it stimulates healing response to the disease by administering substances that mimic the disease in healthy people. Naturopathic medicine, naturopathy. And naturopathic medicine uses natural remedies to enable the body to self-heal. In contrast to holistic medicine, which also uses conventional medicine, this does not use conventional medicine, and it is its own medical care system. It's evolved from a combination of traditional practices and healthcare, which were popular in the 19th century in Europe. Naturopathic physicians, there are two types. There are the ones that are schooled, and there is a 4-year degree program that naturopathic physicians complete, and there's a few of them in the United States and Canada. But there's also traditional naturopathic physicians that do not go through a 4-year graduate course. Naturopathy or naturopathic medicine embraces a whole bunch of things: diet and lifestyle, stress reduction, herbs, dietary supplements, homeopathy. So it incorporates a little bit of everything: manipulative therapies, exercise, detoxification, psychotherapy, counseling, and the list goes on and on. So again, this is not exclusive. It doesn't have everything, but it's gives you a taste of their armamentarium. Now, the next three: functional medicine, complementary medicine, and integrative medicine. In some ways, I think they're very similar, and I kind of had a hard time of differentiating them. So I'm going to do my best to give you this sort of definition of each one. But the truth is they're very close to each other. I titled this talk Functional Medicine, but it could have been complementary medicine or integrative medicine. So functional medicine is a dynamic approach to assessing, preventing, and treating complex chronic diseases. It ameliorates dysfunction in the physiology and the biochemistry of the human body as a primary method of improving patient health. It focuses on treating the individual, not the disease, and it allows the body to heal itself. It's science-based, but it emphasizes itself on the root cause and how function was lost. And I was at a lecture and a practitioner was talking about the image of a tree, the roots of a tree, and then the branches and the leaves of a tree. And that in order to treat the disease in the leaves, you had to go down into the roots and figure out where things were not functioning right, what was wrong with the soil, and address that first. And I thought that was a good image to identify with functional medicine. It uses lifestyle changes and natural supplements along with conventional treatment. So again, this is an add-on. It focuses on the root cause of the health issue and not on the symptoms. So thus the roots and not the leaves. And functional medicine has also been stated as biologically based, and it identifies root causes, but it doesn't just limit it to that. It adds on conventional therapy. Complementary, integrative, similar to functional medicine, and it's in addition to the conventional medicine through multiple modalities. So an integrative medicine doctor or complementary medicine doctor is going to actually be trained in the traditional medical setting with a 4-year degree and probably do a residency, and then afterwards subspecialize in integrative medicine to incorporate additional modalities. So they're well trained. They've just chosen to kind of add something to the traditional training system and their armamentarium. Now, some of the key points are that conventional medicine practices often have little to offer for the dementia patient. There are some medications, but they have limited effectiveness, and we're still actually looking for that silver bullet. And in some ways, these alternative functional complementary integrative medicine approaches realizes that maybe there's not just one way of tackling this. Maybe there isn't just one cause. Maybe there are multiple causes, and maybe we need to identify and address each one in its own way, in the best way possible. Number two, the mind-body therapies that are offered are safe in providing structure, support, and encouragement to patients and families. So diet, herbal medicines, nutritional supplements are used for prevention and treatment of dementia. However, we don't have a lot of evidence to support that they are making a big inroads. The psychosocial support, the encouragement of cognition, creative activities, offers improved quality of life for those suffering from dementia. So we do know that. Addressing the root causes with functional medicine. The basic tenet, again, is that there is no single cause of dementia, but rather a host of contributing factors that need to be identified and need to be addressed individually. And as I said before, it's the analogy of the roots of a tree. Treatments are geared towards the varied contributing factors, and conventional medicine may be used alongside functional complementary techniques. And in many cases, people that go to a integrative physician probably have already gotten some sort of treatment from conventional type of medical protocols. So they may be on medications, they may have gotten certain types of treatments and they end up with, well, limited effectiveness, and so they're looking for something else. We see a lot of this in cancer treatment because of, in some cases of cancer, there is, again, not a good response to some of the conventional treatments. And so people are looking for something else, something added, something that might do more than what conventional medicine does. Okay, so so an interesting book and an interesting man is a guy named Peter Whitehouse, MD, PhD. He is a Clevelander. He wrote this book quite a few years ago. And he comes up with a question about, is dementia a societal problem? And if we look at his questioning, then we sort of, in some ways, also may have some questions about whether this is something that we are doing to ourselves. For instance, number one, modern society's preoccupation with speed, innovation, and productivity. We focus on this. We are always aware of this. And when we age, we give up these three things. We're not as fast, we're not as innovative, we don't produce as much. So those things are what we see in patients that have dementia. Now, if you go back to tribal or village cultures, they actually valued traits such as long-term memory. Precisely those elements of memory, which are often well preserved in dementia. So dementia patients, their recall of remote events is usually pretty good. It's the more recent things that they can't remember, that don't stick, that don't get put into their memory banks. Ancient rituals and values, hunting and planting patterns, traditional healing lore, and archetypal stories are kept safe in the elder's mind. So in tribal and ancient societies, these were things that really were looked upon as being very key to the society. Indeed, if we stress about things, about our mildly failing abilities in the areas of speed, innovation, productivity, and maybe recent memory, may precipitate a downward spiral in which the senior increasingly loses confidence and self-esteem, eventually withdrawing into a more isolated world. So the essence of his theory here is that, in a sense, our society has changed, and in a sense, the dementia we're seeing may be not only a product of pathology, but also a product of the changes in society. What modalities do complementary and integrative medicines use? Well, there's a whole bunch of tools. Meditation, diet, supplements, energy work. I'll give you an idea of what some of these terms are. Reiki is a term that we use for energy, where a person puts hands near you or may touch you and generate energy to you. Giving light is when the hands are held near you, but it is it's a Japanese type of healing. Healing touch, placing hands. Polarity is placing two hands on, and the electromagnetic forces, the polarity of that is somehow healing. Acupuncture, this is where you insert fine, long needles into areas in the meridia where energy is keyed up or is blocked, to try and release that energy. Exercise is both physical and mental to improve the mind and the body. yoga, and yoga, which most of us know about, is just a Hindu discipline with breath control, meditation, and specific body poses or postures. Tai Chi is, again, a traditional Chinese mind-body exercise and meditation with slow sets of movement and controlled breathing. Qigong is a system of body postures, breathing, and meditation. It is also a martial art. And breath work, sleep and sleep hygiene, social connectivity, games, music, art. So there's a whole slew of things that are in the arsenal of the complementary integrative physician. And we can split this down into 5 actual areas: whole medicine, mind, body, biological based, manipulative, and energy work. Whole medicine. These are non-traditional medical approaches. Homeopathy is one, naturopathy, Chinese medicine, which uses herbs, and Ayurveda, which is a Indian type of medicine using herbs. Mind body. So the idea behind mind body is to diminish stress, to diminish cortisol levels. And we do know that cortisol levels are correlated with diminishing mental capacity. The higher the cortisol levels on a sustained basis, the lower the mental capacity. And they have shown that in studies with Alzheimer's patients. So mind body, some of the modalities: biofeedback, guided imagery, hypnotherapy, meditation, relaxation, mindfulness training, exercise, dance, movement, and sleep. So this is mind body, biologically based. And these are the macro and micronutrients, and they have to do with changing your diet, taking botanical medications, vitamins and minerals and supplements, and chelation. And chelation is just a form of therapy where you extract heavy metals, and these are usually they could be copper, iron, some of the more toxic medicines, lead. We've heard a lot about that. So, and even mainstream medicine does use chelations in some instances. Manipulative, the hands-on approach. So here's where things get a little murky, but chiropractic. So chiropractic is where a licensed practitioner treats through spinal manipulation and also through nutritional counseling. And the theory behind it has to do with the spinal cord, the nerve endings, and the activation of all the areas of the body, all the different organ systems through these specific areas in the spinal column. Osteopathy or osteopathic medicine. This is a medical doctor, a DO, a doctor of osteopathy, and they are trained in the traditional way of doctors, MDs. They have the same schooling, they pass the same boards, but in addition to that, they also learn treatment of medical disorders through manipulation, through massage, and through other substances such as diet. And so their training goes beyond the MD's training. And there aren't a lot of DOs that actually practice osteopathic medicine in its pure sense. Most of them just follow the conventional path, but they are schooled in it, and they do take exams, and they know how to, at some point, manipulate the joints, mainly the spinal joints. Massotherapy is a form of massage. Reflexology, it's a system of massage based on the theory that there are reflex points on the feet and hands and that these are linked to other parts of the body. Moxibustion, I think there's a picture of it somewhere where, again, these are traditional Chinese medicines, and it's a heat treatment. The herb is burned on or above the skin to warm and stimulate an acupuncture point of an affected area. Cupping is similar. Heated cups are applied to the skin along the meridians, creating suction as a way of stimulating energy flow. And then finally, energy-based acupuncture, Qigong, Tai Chi, Reiki, therapeutic touch, giving light, polarity are based on releasing energy throughout the body so that you can help self-heal. And all of these are variations on the same theme. In functional and complementary medicine approach, there are 4 key elements. Why do they think this works any different or any better than conventional medicine? Well, number one, they feel that if there is a reduction of the inflammatory response through their therapies, that improves the patient's mental health, actually the cognition. If they optimize nutrients and correct deficiencies, this will also help. Eliminate exposures to toxins. And lastly, nurture connection, social engagement to enhance neuroplasticity, the ability of the brain to kind of create new connections. Reduction of inflammation, number one. Why is this so important? We do know that reduction of inflammation reduces many diseases, including vascular disease in the brain. This improves circulation and it improves oxygen delivery. So because the brain is using about 20% of the oxygen in your body and it only weighs about 5%, it's very, very hungry for oxygen. It needs a lot of it. And when you restrict the blood flow, you restrict the oxygen supply. So reduction of inflammation allows that to maintain itself. Reduction of inflammation in the gastrointestinal tract improves the immune system's control of infections and toxins that enter the circulation, and it minimizes their ability to breach the blood-brain barrier. An interesting thing also about the gastrointestinal tract is that by reducing inflammation and helping the immune system, it also allows the gastrointestinal tract to digest food better, to allow better incorporation of nutrients into your body. Reduction of inflammation also controls cortisol and the adrenaline levels in the body. And so the lower the inflammation level of the body, the lower the cortisol and adrenaline. And these are toxic to critical memory areas, especially the hippocampus, which is short-term memory area. And lastly, reduction of inflammation lowers insulin levels. It improves brain function, and that has been studied and correlated with conventional medicine. And this is just kind of a slide showing that chronic inflammation affects a lot of things. Neurologic disorders and cardiovascular disease are the two that really impact the brain and the brain's function. We also know that increasing antioxidants through diet and supplementation sometimes, and there's some controversy about supplementation, but at least through diet, neutralizes excess oxidative stress, which is a major contributor to inflammation. So diet can have an impact on the amount of inflammation in your body. Optimizing nutrients, avoiding deficiency states. We know that B1, B12, and folates contribute to brain dysfunction. And we know that diet and supplement can correct these levels. Also, we also know that dietary fiber will improve the levels of certain bacteria in the gut, which will improve the level of serotonin that is released. And serotonin is kind of a calming. It's something that improves your mood, and in some ways decreases the stress levels. So it is a de-stressor. Eliminating toxins, smoking, excess alcohol, lead, mercury, aluminum exposure, and toxins from microorganisms generated in the gut. We do know that the microbiome in the gut is impacted by dietary choices of food and cooking styles. So that if we decrease high heat cooking and deep frying and using processed meat consumption, we actually improve the organisms in the microbiome. And by improving them, then we improve the neurotransmitters and we decrease the cortisol and adrenaline levels throughout the body. And lastly, a proper sleep, which optimizes non-REM sleep, helps in actually detoxifying the brain. These periods of non-REM sleep are critical for getting rid of toxins, but also REM sleep helps consolidate memory. Nurturing connection and social interaction. So engagement in activities, enhancing conversations with caregivers, friends, and professionals, recreation and education and social settings, environment. So there's this term, and I'll get to it next, but it's called snozolim, which was first, I guess, initiated in Israel for dementia patients, and creative expression. So the snozolim is actually a room where there are multi-sensorium, there are visual, pleasing visual things, pleasing auditory, pleasing things in terms of smell and touch. And it's sort of a whole mind body type of sensation. And that has shown to improve dementia in terms of some behaviors that are being modified. So I want to end up with Dr. Peter Whitehouse's 9 elements, and then I'll just add on to it in the end. His plan for prevention for dementia. The diet: fewer saturated fats and trans fats. Eliminate fast and processed food. And we do know that it's important in terms of inflammation to keep your ratio of what's called omega-6s to omega-3s at a low level. And omega-3 is found in fish, but in also some other oils. It's found in olive oil. Omega-6s are found more in the vegetable oils. And so we do consume a lot more vegetable oil. And in the Mediterranean diet, they consume less, and actually they utilize sesame and olive oil. Moderate alcohol, salt, total calories. And actually obesity is correlated in the early stages with declining mental capacity. Later on in the dementia patient, they seem to lose weight because of lack of interest and things like that. He also says to increase your vitamin, mineral, and antioxidants through fruits, vegetables, whole grains, legumes, and when needed, supplementation. 2, limit your exposure to toxins in foods and household items. Pretty self-explanatory. Stay physically active. Number 4, build cognitive reserves through education, stimulating activities, learning new skills, challenging yourself mentally. So kind of filling up the tank as high as it can get, because we're all losing a little bit every day. Reducing stress. Minimizing inflammation. Improving such disease states if you have them, like hypertension, vascular disease, diabetes, and obesity. Number 7, maintain and grow social networks. Number 8, cultivate a strong sense of purpose. And number 9, remain positive and uplifting to yourself and others. 8 and 9 are really sort of the self having to do the work. And I put a slide in here saying, just do no harm. Prevention is the first line of defense. By optimizing your cardiovascular system, your blood pressure, your lipids, and your sugar level through an anti-inflammatory diet. The exercise he spoke of, stopping smoking, reducing alcohol, reducing stress, staying active and connected, mentally stimulated, having proper sleep. Key point is that mind-body therapies, and I'm reiterating this just to sum up, they are extremely safe in providing structure, support, and encouragement to patients and their families. Herbal medicines and nutritional support are widely recommended and used for prevention and treatment of dementia, though, again, we don't have good support in terms of the literature. And lastly, psychosocial support, encouragement of cognitive activity, offering opportunities for creative activity offers an improved quality of life for patients with dementia. We may be able to help dementia patients and families by embracing a variety of approaches derived from the social, psycho, nutritional, biological, and spiritual dimensions of human life. I've just included a few references, a couple books, and I'm happy to answer any questions. I'm not sure if I have the answers, but I will certainly attempt my best.
Thank you very much. Yes, we'll take any questions. And again, if you want to send them through the Q&A function, just like before, we'd be happy to take your questions. All right, looks like we got one. In your opinion, is integrative medicine a substitute for conventional medicine?
So it's not a substitute. And in fact, every integrative medicine practitioner is supposed to, they're supposed to add on to conventional therapy. They've been trained in it, and they're supposed to not discourage, but they're supposed to add on to it, so that, let's say you're going through some therapies and they're not working, they may not, I don't think they would stop or encourage you to stop what you're doing, but they would advise you to do some additional things. So,
okay. Can you tell us a little bit about how you approached it in your practice with your patients? I mean, can you give us some examples of maybe some ways you worked with traditional medicine and other methods?
well, let's see. I've always encouraged those people that are interested in taking the medication, seeing, let's say if they had vascular disease, seeing the cardiologists, having the tests, if they need to have procedures done. But I also wanted them to realize that they can improve their chances of better outcomes if they change their diet and their activity levels. So it wasn't that I discouraged them, but I wanted to add on and give them the best chance for the best outcome. And I think if you do nothing, and the other thing is that you have skin in the game. You're kind of incorporating the person as part of the healthcare plan. And too much of medicine nowadays is, I'll just leave it up to leave it into the hands of the doctor. And in fact, you are shortchanging yourself, because there's a lot you can do with proper guidance. There's a lot you can do that improves the outcome.
And a lot of these the things you went over today, I feel like they're very preventative too. So if you're
Yes,
starting this younger, um, you may
yes,
have a very different outcome. So
yes, absolutely.
very good. Thank you. Someone asked, are there any disadvantages to functional medicine approaches that are out there?
Well, I think there are some functional medicine approaches that may not be as beneficial as we think. For instance, and the one that comes to my mind is heavy supplementation with a lot of vitamins and minerals for two reasons. Number one, high doses of supplements, we're not sure what that does. The natural occurring vitamins and minerals, they are kind of in a package. They're sort of synergistic in some ways, I think. But when you have high doses of certain vitamins or minerals, your body is actually having to deal with that. And we don't know if that's a stress on the body's system, maybe it's utilizing some enzymes to a higher degree, and then it's taking away from those enzymes being available for something else. So, it's kind of like maybe running on high test when you don't really need that, and there may be some disadvantages. So that's the one thing about functional medicine that may be a drawback.
Isn't it true that some supplements can actually have an adverse effect on certain medicines as well, right?
Yes, absolutely.
Can you tell us a little bit about maybe some common ones that people wouldn't know?
On certain medicines,
Mhm. Maybe I'm putting you on the spot.
I'm
Sorry.
trying. That's a good one. You, I mean, mm, vitamins. Well, there's certain minerals that if you take too much calcium, you can cause some problems with the circulation. Let's see. Some of the ones are more like high doses of vitamins, but I'm not sure that I can tell you how they interact with specific medications.
Okay.
Yeah,
Thank
so
you.
that's a hard one.
Thank you. No
Something.
problem. Okay. I did get another question here. Much of the time, the residents of my mom's dementia care facility sit around on comfortable chairs. Do these patients need a great deal of downtime for emotional and cognitive balance? How much creative and other activities are a good idea?
So if they're sitting around for most of the time, it's kind of not very stimulating. It just kind of adds to the downward spiral. I think they can tolerate a lot more than we think they can. It's labor intense. I mean, part of the problem is our resources. So, double-edged sword. We don't have the resources. You look at nursing facilities, they don't have the resources. And so people are being exposed to less and less because of that. But I think they could tolerate a lot more. I don't think you have to worry about that end of the spectrum.
It's all about the time and attention to putting a lot of these approaches into place. And that's a very good point you mentioned. It's the resources aren't there to put that attention on it.
And we don't fund them. It's not a priority. And an older person will tell you, I'm done. I don't want to do anymore. They'll let you know. But it's really about where what we prioritize, and we don't prioritize the elderly, and we don't prioritize dementia, and for various reasons, but I suspect one of the reasons is that it's pretty scary to look at, and it's hard to deal with. So we don't want to deal with it. We don't want to put any money towards it to kind of help it out.
Mhm. Maybe this leads us into this next question. How can family members and professionals advocate for a family member to get more of this type of integrative approach along with their conventional medical care? If you work with a doctor that maybe doesn't believe
Right.
some of these factors, how can you advocate for that?
Well, I mean, the clinic and UH have integrative medicine programs. They have practitioners, nurse practitioners, doctors, and maybe utilizing some of those resources. JFSA is, I would say, fits into that integrative medicine approach. So they'd have to reach out for these resources, but there are some there. And I'm not saying to fire your doctor, but you can always have a second opinion. You can always get a subspecialist, and this is really a subspecialist. So,
Mhm.
the primary care doctor's got their hands full.
Mhm. Mhm.
Um,
In your
and I
opinion,
don't think they would object to any of this.
do you find this to be a growing field, more of a trend then?
Yes, but the problem is, again, I hate to go back to economics. Some of it's not paid for, large portions.
Mhm.
So the cost burden is one aspect, and practitioners, they kind of go where the money is.
Mhm.
Um, and if insurance companies would realize that there's an upside to this preventive medicine, and some of them do. Some of them do realize, exercise and things like that, and stress reduction. That in the long run saves them, even though they may have to invest in the short term.
Mhm.
So it depends on who's writing the check, whether they can realize this. And if you want to advocate, I would say, bang on their doors.
Right. Right. Well, thank you very much.
You're welcome. It's a pleasure.
Yes. Thank you. And I hope that this can, show families that they can advocate for more of this type of care, because we talk all the time about how, changing the environment for the person with dementia can make their quality of life better. And a lot of these are quality of life factors. So thank you. So thank you again, everyone, for coming tonight. Nicole and I are available if anyone has questions about our dementia program. If you have anyone in the community that has a memory concern, we can link you up to various supports. Most of our clients do want to stay at home as long as possible. So we really work with them to try and do that. We have 2 geriatricians as part of our program, Dr. Elizabeth O'Toole and Dr. Constance Magulius. You can see them here at JFSA at our Allison's Place clinic. We also have on our team Frank Petrelli. He's our general psychologist and he assists us with cognitive testing. Pamela Lynch is our health educator, and she is the facilitator for our Caregiving with Confidence workshops and our caregiver support group. Leanne Stuver is also part of our team, and you'll see her here on our brain health and wellness webinars. So in summary about our program and what we offer, we have ongoing caregiving with confidence workshops throughout the year. There are still spots available as our class is starting next Wednesday if anyone is interested. We have a support group that is offered on the second and fourth Mondays of the month. We have a home care program through our JFSA Care at Home. And then, of course, our ongoing Brain Health and Wellness Initiative series, which is the support group, Caregiving with Confidence, and this series is all virtual. Up next month, we have Dr. Elizabeth O'Toole with us on July 20th at 6:30. So we hope you can listen to this one as well, kind of going off of wellness and those themes. Dr. O'Toole will be talking about non-pharmacological management of behavioral symptoms in dementia. And of course, if there are any questions about attending tonight or our programs, please feel free to reach out to Nicole or myself. So thank you all for coming tonight, and we hope to see you next month. Thank you all.